Are you struggling with type 2 diabetes and searching for the best strategies to control it effectively? Look no further. In this video, we will compare two commonly prescribed medications for managing type 2 diabetes, Metformin and Victoza. Metformin, a widely used oral medication, helps regulate blood sugar levels by reducing glucose production in the liver and increasing insulin sensitivity. On the other hand, Victoza, an injectable medication, mimics the effects of a naturally occurring hormone called GLP-1, which stimulates insulin production and lowers blood sugar levels. While both medications have proven to be effective in controlling type 2 diabetes, they work in different ways and have distinct advantages. By understanding the differences, you can make an informed decision on the most suitable medication for your specific needs. Join us as we explore the benefits, side effects, and usage guidelines of both Metformin and Victoza, empowering you to take an active role in managing your type 2 diabetes effectively. Remember, always consult with your healthcare provider before making any changes to your diabetes treatment plan. Overview of Metformin and Victoza. Metformin and Victoza are two commonly prescribed medications for the management of type 2 diabetes. Metformin is an oral medication, while Victoza is an injectable medication. Metformin. Metformin is a first-line treatment for type 2 diabetes. It belongs to a class of medications called biguanides and works by reducing glucose production in the liver and increasing insulin sensitivity in the body. This helps lower blood sugar levels and improves glycemic control. One of the advantages of metformin is that it does not cause hypoglycemia, which is a condition characterized by abnormally low blood sugar levels. Additionally, metformin may also help with weight management in individuals with type 2 diabetes, as it can cause modest weight loss. Victoza. Victoza is a medication that belongs to a class of drugs called GLP-1 receptor agonists. It works by mimicking the effects of GLP-1, a hormone produced naturally in the body that stimulates insulin production and lowers blood sugar levels. Victoza is administered through a once-daily injection and has been shown to effectively lower A1C levels, which is a measure of long-term blood sugar control. It also helps with weight loss, making it a favorable choice for individuals with type 2 diabetes who struggle with obesity. How metformin works for type 2 diabetes control. Metformin works by targeting the underlying causes of type 2 diabetes. It primarily acts on the liver to reduce the production of glucose, a process known as gluconeogenesis. By inhibiting this process, metformin helps lower blood sugar levels. In addition to reducing glucose production, metformin also increases insulin sensitivity in the body. Insulin is a hormone that helps regulate blood sugar levels by allowing glucose to enter the cells for energy. By enhancing insulin sensitivity, metformin improves the body's response to insulin, making it more effective at lowering blood sugar levels. Another way metformin helps control type 2 diabetes is by slowing down the absorption of glucose from the intestines into the bloodstream. This further contributes to maintaining stable blood sugar levels. How Victoza works for type 2 diabetes control. Victoza works by mimicking the effects of GLP-1, a hormone that stimulates insulin production and lowers blood sugar levels. GLP-1 is naturally released by the intestines in response to food intake. When Victoza is injected, it binds to GLP-1 receptors in the body, activating them and triggering the release of insulin from the pancreas. Insulin then facilitates the uptake of glucose from the bloodstream into the cells, where it is used for energy. In addition to stimulating insulin production, Victoza also slows down gastric emptying, which means that food stays in the stomach for a longer time. This helps control blood sugar levels by reducing the rate at which glucose is released into the bloodstream after a meal. Furthermore, Victoza promotes satiety, leading to a decreased appetite and reduced food intake. This can be beneficial for individuals with type 2 diabetes who struggle with weight management. Key differences between metformin and Victoza. While both metformin and Victoza are effective in managing type 2 diabetes, there are some key differences between the two medications. Administration. Metformin is taken orally, usually in the form of tablets or extended-release tablets. Victoza, on the other hand, requires a once-daily injection using a pre-filled pen. Mechanism of action. Metformin primarily works by reducing glucose production in the liver and increasing insulin sensitivity. Victoza, on the other hand, mimics the effects of GLP-1 to stimulate insulin production, lower blood sugar levels, and slow down gastric emptying. Weight management. While both medications can contribute to weight loss, Victoza is more effective in promoting weight loss than metformin. This can be beneficial for individuals with type 2 diabetes who struggle with obesity. Hypoglycemia risk. Metformin does not typically cause hypoglycemia when used as a monotherapy. However, when combined with other medications that can lower blood sugar levels, the risk of hypoglycemia may increase. Victoza, on the other hand, has a low risk of hypoglycemia when used alone. Benefits and side effects of metformin. Metformin offers several benefits for individuals with type 2 diabetes, including effective blood sugar control. Metformin helps lower blood sugar levels and improves glycemic control in individuals with type 2 diabetes. Weight management. Metformin can cause modest weight loss, which can be beneficial for individuals who are overweight or obese. Cardiovascular benefits. There is evidence to suggest that metformin may have cardiovascular benefits, such as reducing the risk of heart disease and stroke. Despite its benefits, metformin may also have some side effects. Common side effects include gastrointestinal symptoms such as nausea, diarrhea, and stomach upset. These side effects are usually mild and subside over time. In rare cases, metformin may cause a serious condition called lactic acidosis, characterized by the buildup of lactic acid in the body. It is important to seek medical attention if you experience symptoms such as weakness, dizziness, or unusual muscle pain while taking metformin. Benefits and side effects of Victoza. Victoza offers several benefits for individuals with type 2 diabetes, including blood sugar control. Victoza effectively lowers blood sugar levels and helps improve glycemic control. Weight loss. Victoza is associated with significant weight loss, making it a favorable choice for individuals with type 2 diabetes who struggle with obesity. Cardiovascular benefits. Similar to metformin, Victoza has shown cardiovascular benefits, including a reduced risk of heart disease and stroke. While Victoza is generally well tolerated, it may have some side effects. Common side effects include nausea, diarrhea, and stomach upset. These side effects are usually temporary and subside over time. In rare cases, Victoza may cause pancreatitis, a serious inflammation of the pancreas. It is important to seek medical attention if you experience severe abdominal pain that does not resolve or worsens while taking Victoza. Choosing between metformin and Victoza. When it comes to choosing between metformin and Victoza for the management of type 2 diabetes, several factors should be considered. Personal preference. Some individuals may prefer the convenience of an oral medication like metformin, while others may be comfortable with the once-daily injection of Victoza. Weight management goals. If weight loss is a priority, Victoza may be a more suitable choice, as it is associated with significant weight loss compared to metformin. Other health conditions. Individuals with certain health conditions, such as kidney disease or pancreatitis, may have specific considerations when choosing between metformin and Victoza. It is important to consult with a healthcare provider to determine the most appropriate medication based on individual circumstances. Cost. The cost of medication can also be a factor in the decision-making process. Metformin is generally more affordable compared to Victoza, which may be a consideration for individuals with limited financial resources. Ultimately, the decision should be made in consultation with a healthcare provider who can assess individual needs and provide personalized recommendations. Strategies for type 2 diabetes control using metformin. If metformin is the chosen medication for type 2 diabetes control, several strategies can be implemented to optimize its effectiveness. Adherence to medication. It is crucial to take metformin as prescribed by a healthcare provider. Skipping doses or altering the dosage without medical supervision can negatively impact blood sugar control. Lifestyle modifications. Alongside medication, lifestyle modifications play a vital role in type 2 diabetes management. This includes following a balanced diet, engaging in regular physical activity, and maintaining a healthy weight. Regular blood sugar monitoring. Monitoring blood sugar levels regularly can help gauge the effectiveness of metformin and make necessary adjustments to the treatment plan if needed. Communication with healthcare provider. Regular communication with a healthcare provider is essential to address any concerns, discuss medication adjustments, and ensure optimal management of type 2 diabetes. Strategies for type 2 diabetes control using Victoza. If Victoza is the chosen medication for type 2 diabetes control, the following strategies can be implemented to maximize its efficacy. Proper injection technique. It is important to learn proper injection technique to ensure accurate dosage and minimize any discomfort or complications associated with the injection. Adherence to medication. Consistency in taking Victoza as prescribed is crucial for its effectiveness in controlling blood sugar levels. Lifestyle modifications. As with any type 2 diabetes management strategy, lifestyle modifications are essential. This includes adopting a healthy eating plan, engaging in regular physical activity, and maintaining a healthy weight. Regular blood sugar monitoring. Regular monitoring of blood sugar levels helps track the effectiveness of Victoza and allows for adjustments to the treatment plan as needed. Communication with healthcare provider. Regular communication with a healthcare provider is important to address any concerns, discuss medication adjustments, and ensure optimal management of type 2 diabetes. Conclusion. Metformin and Victoza are both effective medications for the management of type 2 diabetes. While metformin primarily works by reducing glucose production and increasing insulin sensitivity, Victoza mimics the effects of a naturally occurring hormone to stimulate insulin production and lower blood sugar levels. When choosing between metformin and Victoza, factors such as personal preference, weight management goals, other health conditions, and cost should be considered. It is important to consult with a healthcare provider to determine the most appropriate medication based on individual needs. Regardless of the chosen medication, adherence to treatment, lifestyle modifications, regular blood sugar monitoring, and open communication with a healthcare provider are key strategies for effective type 2 diabetes control. Remember, always consult with your healthcare provider before making any changes to your diabetes treatment plan.